Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. And this week's topic is going to focus on the thoracic spine. The thoracic spine is in the mid-back. It's comprised of 12 vertebrae and typically gets irritated when you're sitting for an extended period of time and exhibit poor posture. This week, our medical director, Dr. Michael Marciello, is going to be talking to you about the unique team approach we have when we're dealing with pain or stiffness in the mid-back. Take it away, Dr. Mike.
How's your posture? If you're watching me today, rather slumped down, looking at the camera, looking at your monitor and your screen, all slumped over, and you know what someone's gonna say, sit up tall, you got poor posture. When we think about the thoracic spine in relation to what our posture is, unfortunately, it's difficult for us as we're all forward people working on our computers, looking on our cell phones, to actually maintain good posture all the time. But realities are, we sometimes can blame a person for having poor posture. Sometimes there's weakness in our trunk and our lower back, and we just have to relax into the chair, but it pulls our shoulders forward, and that results in poor posture. But there are things that also can cause poor posture appearance when it's not your fault. There are conditions of inflammatory process in the thoracic spine that result in what we call kyphosis, or rounded posture, which really means roundedness in the upper back at the spine level. Ankylosing spondylitis is a condition that can cause that. Compression fractures as you get older and may in fact result in wedging or breaking down of the bone of the spine that results in a rounded posture. Or even people who have Parkinson's disease, their process of degeneration leads to a tilting forward, a leaning, and a kyphosis in their posture. These conditions are more difficult because they need to be assessed, they need to be determined to be the diagnosis, but it isn't something we can just say, hey, stand up tall and correct that. But for people who do have poor posture and are not keeping track of their best position, we want to help you. Come on into Maragal Medical, because as you know, we do it as a team approach. We look at it from the medical side to make sure that diagnosis is correct. We look at it from the physical therapy side to increase your strength, increase your lower back strength to help up your ability to hold your posture or your body's strength in good position. And of course, chiropractic in order to adjust those joints of the spine that are getting now more restricted and moving more stiffly or not moving at all, just that we can make sure that motion of the shoulders, upper back, and the mid-back can be adjusted to allow that person to be upright and tall. We have to remind people without question that if you're working at your computer, how your vision is, where you position your head and neck to see the screen may result in where you sit on your chair. And that all can result in poor posture. And then ultimately when we're standing, we don't want to make sure that the level of your pelvis is there because we don't want to see a hunching or leaning forward. So when we think about the thoracic spine, we think about the posture of people. We think about the inflammatory aspects of the spine as well as the degenerative disc issues. We want to help you here. If you're having problems with your posture, if you're not quite sure why someone keeps on yelling at you, sit up tall, stop hunching over. If you have that nag in your side, or you feel like, why is my upper back just always hurting? Give us a call. We're here to help. We'd like to kind of demonstrate what we can do to make a difference. There are incredibly new braces that are on the market that we can help prescribe to give a little bit of a lift with a pressure point to the mid-back to allow your muscles to constantly be reminded to have a good posture, standing up tall or sitting tall, as opposed to just what the old braces would be like a corset, just pulls your shoulders back and may not be helpful at all. We want to look at those choices because we can really make a difference in a person who has thoracic kyphosis and thoracic back pain. We'll see you next week. Give us a call. Take care.
Boy, that was great information, Dr. Marciello. I think the viewers now have a better understanding of all of the available treatment options that they have for treatment if you have pain or stiffness in the mid-back. Folks, at Maragal Medical, we're a unique physical medicine clinic where we've combined medical care, chiropractic treatment, and physical therapy all under one roof. And we utilize newer technologies like regenerative medicine that help heal the damage to the joint, especially when it comes to arthritis. If you like the information you saw today, please subscribe to our YouTube channel. More information about our practice can always be found on our website at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical lead you on a path to wellness. Well, that's all for today. I hope you learned something. Have a great day, everybody. We'll see you again next week. Take care.